Africa and around the world, school bells are finally ringing for students to return to classrooms. For over 18 months, nearly 77 million children worldwide were out of classrooms, according to a recent report from the United Nations Children's Fund. And more than 131 million students in 11 countries had no access to in-person schooling. Across Eastern and Southern Africa, it is estimated that 40% of all children are currently not in school at all due to COVID-19 closures. The World Health Organization said last year that the difficult decision to encourage governments to reopen schools amid a pandemic was a necessary one to avoid adversities such as teenage pregnancies, child abuse, substance abuse, anxiety, loneliness, just to name a few. Meanwhile, a new school year is underway, but the threats of COVID-19 continues. Hello, I'm Oriani Tangishaka, and this is Our Voices. On today's program, we'll take a look at some of the safety measures put in place as children return to classrooms as the Delta variant surges during this COVID-19 pandemic. We'll look at how governments, educators, parents, and students are confronting the challenges of the new normal crafted by the deadly disease. And we'll examine other challenges in some academic systems on the continent, such as teacher strikes. Let's begin. The Somali government reopened schools this month despite a new wave of COVID-19 infections. As Mohammed Shiknur reports from Mogadishu, there are some concerns on whether measures to prevent the virus's spreading in the classrooms and beyond is sufficient. Let's take a look.
Early morning in a Mogadishu school, and students arrive to prepare for the day's activities. None of the students are wearing masks as they mingle, even though the country is experiencing a new wave of COVID-19 infections. Khadija Adam is the principal responsible for the day-to-day running of the institution. She has a daunting task ahead, trying to keep her students safe while in school.
We keep reminding our students about good sanitation. The students understand that they must wash hands. We lobbied the Ministry of Education and they have supported us with hand washing facilities. We normally instill in students that it is compulsory to sanitize their hands and wear masks, as this will enable schools to remain open.
In Somalia, uptake for COVID-19 vaccines remains low. The most vulnerable are the elderly, and there is fear school reopening might increase infections among the students who will ultimately expose their families. Abdifatah Muhyiddin is a student at the school and fears for his older relatives.
I am really worried about the coronavirus as it has returned and reached its peak. I'm concerned about the health of my family since school has reopened, and I might get infected in school and take the virus back to my family.
The prolonged closure of schools due to the pandemic had a negative impact on the lives of young Somalis. There was a significant increase in school dropouts, and this disrupted the social and economic well-being of families. Abdifatah Mahmoud is a trader in Mogadishu, and after a hard day's work, finds time in the evening to mentor his two teenage daughters, hoping they will catch up on lost time.
The long lockdown negatively impacted education. Some girls disappointed with education got married and started families. Boys who dropped out became either touts on passenger vehicles or migrated to other places. The length of the lockdown really affected education.
Mohammed Abi, Director General of Somalia's Ministry of Education, acknowledges the hardships.
One of the principal side effects of the coronavirus on education is that even the few students who showed resilience to continuing with education performed poorly during exams. Performance was below average, unlike any other time in the past. The quality of education went down, and some schools had to close down.
When it announced the reopening of schools, Somalia's Ministry of Education promised preventive measures were in place to ensure learning returns to normal. Students are required to wear face masks and maintain social distancing, among other measures. However, not all of these preventive measures are being followed, as seen in the Mogadishu school. Mohammed Sheikh Noor for VOA News, Mogadishu, Somalia.
Here in the United States, students are returning to class for a new school year, just as the number of Delta variant of COVID cases are on the rise. Experts say that children seem to be vulnerable to this variant, raising questions about how to protect them, especially those who are too young to be vaccinated.
Since the coronavirus pandemic hit the U.S., over 36 million Americans have been infected, about 4 million of them children, according to the American Academy of Pediatrics. After a relatively calm few months, the Delta variant is causing a new surge of cases, just as children are returning to class for the new school year. Dr. William Raska is with the University of Vermont Medical Center.
Nobody under the age of 12 has been immunized. So by definition, there's a huge susceptible population.
The most difficult situation, experts say, can be seen in the South, where vaccination rates are low and the Delta variant is spreading especially fast. Also, a number of governors in states such as Florida, Texas, and Arizona have banned mask mandates, although some school districts reportedly are defying those orders.
If schools go into the school year without masking and stay unmasked from, say, September to December, they will infect most of the kids that attend school. It's that transmissible. It's much more transmissible than it was last year.
Dr. Danny Benjamin, a distinguished professor of pediatrics at Duke University, participated in 3 studies looking at the impact of face masks on the spread of COVID-19 in schools.
And we studied over 1 million children and adults this past spring with no distancing, 3 children to a bus seat, schools open full time for everyone. And again, the chance of a child infecting somebody else at school once, if they came to school with COVID, was 1% or less.
But those who oppose face mask mandates argue such orders violate their freedom and that wearing a face mask is a matter of personal choice and responsibility. Many others have expressed distrust of the government and its claims the vaccines are safe. Meanwhile, experts say getting more people vaccinated is key to controlling the virus.
If we vaccinate the community, then the schools are safe. And then when the schools open, obviously we should try to vaccinate all our children aged 12 and older. They're still not well vaccinated.
With the fast spread of the Delta variant, the American Academy of Pediatrics has already encouraged healthcare regulators to approve the use of COVID vaccines for children aged 5 to 11 as soon as possible, and approval is not expected for a few more months. Daria Digoods for VOA News, Washington.
Now, to discuss the current situation and students returning to school, I spoke to Dr. Eme Rurangwa, a public health expert and a senior HIV and AIDS advisor for the U.S. Agency for International Development. I began asking her about the role of government.